Thanks for joining us tonight, today, this afternoon, this morning. We are global. My name is Dr. Tovah Goldfine. This is post-corona. This is corona. This is pre-corona. This is a new reality. That's for sure. And, this is kind of a reality show, but this is a health show. And we believe that you can create your own health. There's a doctor inside of you that is brilliant, that knows so much more about you than doctors. And, we're all working these tools all the time, all of us included. I have a new motto that I use. It's called deal, heal, feel, and then some. So this is what I wanted to show you. I'll send it to you, or you can PM me. It's called Pay Attention, Tell the Truth, and Don't Duck. And I think it's really pertinent. And I just want to say one thing about this evening. About an hour ago, my internet went out, and I thought I would get a rash or a migraine. And I realized that all I could do was drink a little wine and say a little tefillah, which means prayer in Hebrew, and surrender. And so if it does go out, stay with us, please. I'll just put on my hotspot and we'll rev up again. We'll beam up again. So on that note, my shining light co-host, Rose Horry.
Good morning. Thanks for joining us again. It's lovely that we're able to come together in this time. I just want to mention that about the pain we're all feeling of unemployment, with the consequences of loss of self-esteem, having to live in close quarters with members of our household that we may not always agree with. It's quite painful. Maybe isolation from loved ones, loss of networks. We are all experiencing different circumstances, but around us we've got, how would I put it? Yeah, suffering, I suppose, is the best way of putting it. Suffering, and many of us know people, family members that have actually been affected by coronavirus. And to those people that have lost loved ones, we send our sympathy and our care. So, and in that context, personal pain is usually exacerbated. So before we introduce Dr. Amir and Michael, I'd like us to just take a few moments to relax our bodies. Notice if you're tight around your shoulders, your jaw, your hips. Breathe in a deep breath, hold it, slowly exhale to release some of your tension. We'll also do a short breathing exercise after our Q&A as we finish. Again, please comment on the side panel, and Tovah will respond to those questions after Michael and Amir have spoken to us. My name's Rose Horry. I practice intensive short-term dynamic psychotherapy, in short, ISTDP. It's a modality that focuses on revealing the repressed and neglected feelings hidden in the unconscious. The work releases us from the underlying feelings and negativity, and opens up to us the hidden pain that's been affected by original attachment. So, and consequently, physical pain. Dr. Amir Zivony is a GP, a practicing family medicine physician, and a consultant at a pain clinic. He's also a father and husband. We also have a special guest, Michael Goldberg, father, husband, netball coach, and CPA. Dr. Amir will give you a snapshot of working in the area of chronic pain. He is well versed in Dr. Sarno's philosophy and interventions. Michael will recount how he had Dr. Sarno's book on his bookshelf. One day, in desperation, he opened the pages, and his healing began. I was reminded of the old adage, when the student is ready, the master appears. Both Amir and Michael have young families, and their discussion will focus on the question of whether community recognition of the role of fathers of young families is adequate. And most importantly, in your opinion, could responsibility, stress, pressure to be the very best dad bring on TMS symptoms? I hope you enjoyed their discussion, and please add your comments about your experience and the added responsibility and, of course, the broken sleep that fatherhood brings. Please let us know where you are in the world. And please ask questions, make comments as we go along. Dr. Tovah will read out the questions from the audience, and over to you, Dr. Amir.
Hi, thank you, Rosie. My name is Amir Zivony, and I'm a family physician based in Israel. I was born and raised here. And as I started my medical school, I was always interested in mind and body, and I wondered where I would find myself when I finished medical school. I decided on family medicine, as it was the most holistic discipline in medicine that I could find. As I did this residency in family medicine, I found Dr. Sarno, my mentor back then, gave me his book, The Mind-Body Prescription, and I was fascinated and surprised that I haven't heard about it before. I was also very interested in man and feelings. I guess it came from my personal interest and how I was not connected to my feelings. During my residency, I also studied how to facilitate men's circles. And both these interests came together as I'm treating today men and women, but I understand more about the hidden emotions inside and how they can be symptomatic and cause pain and other symptoms. And without further ado, I would like to give the ball to Michael and for us to hear his story. Please, Michael.
Thank you, Amir, and thank you, Dr. Tovah and Rose, for having me. So my journey started in November 2018. Prior to that, I've always had lower back, it would always be like a little tight. The most severe episode I had was in 2011. My wife and I were on our honeymoon in Thailand, and I got a Thai massage about a few days before we were heading back to Israel. And when we landed, we drove home, and I tried to get out of my car, and I couldn't stand. And I said to my wife, "I cannot get up." She said, "Yeah, you could get up." I said, "I cannot get up." And I was in bed for 3 days, and it passed. And I've always played basketball throughout my whole life. And after games, I would feel like tightness in my lower back, but nothing too serious, and nothing, it would go away after, the next morning or maybe the next evening. In November 2018, I had a basketball game on Saturday night. And on Sunday morning, I woke up with excruciating pain that I did not know about before, and I did not experience, from my left side of my lower back down to like behind my knee. So it was excruciating lower back and sciatica pain. And I figured, I'll go to my local pool and I'll swim it off, like any other pain I experienced. So I went to the pool and I tried to swim it off. The next day, it kept on getting worse. I mean, every day, and my life basically turned upside down. The most simplest things of life were just living hell. I could not draw. I had to stop about every 10 minutes on the way to work in my car. Driving was a nightmare. Waking up in the morning was a nightmare. I dreaded bathing my girls at night because it was so painful. It was just really, really difficult to sleep. And I would say after about a month, I decided this thing is not going away. I'm gonna go see a doctor, an orthopedist, in the Kupa, which is the public healthcare in Israel. And I walk into the doctor's office, and I said, I've excruciating lower back pain. I couldn't lift my left leg. And he said, oh, you probably have, a slipped disc or something disc related. And then I heard that, and that was like one thing that I always feared in my life, was having something to do with the disc, because I knew that, anything that had to do with continuing playing basketball was probably not such a good thing for it. And I said, okay, what should I do? He said, well, look, there's nothing much you could do. You could go swimming. You could. Here's a prescription for physical therapy and narcoxia, or I'm not sure how to pronounce it. Amir, you could probably elaborate on it. But it's an anti-inflammatory pill. And he said, before I left, he said, and you could forget about ever playing basketball for the rest of your life. And my jaw dropped, mamash dropped, and I was in total shock and really, really upset and depressed. And I left there, and I basically canceled my membership. I was doing CrossFit at the time. I canceled my membership doing CrossFit. I stopped playing basketball for the season. And I basically was in a really, really dark place. The pain got so bad that I couldn't sit in my. I used to work in an accounting firm, so I used to sit in front of a computer most of the day, and I literally could not sit at my desk. So my company, they built a stand for me, so my computer was on a stand, and I stood the entire day for months. Now we're in January, late January. And I remember we were at a dinner. We went out for my mother-in-law's birthday to a restaurant, and the whole family was there. And she invited a very close friend of hers, and I knew him, from around. And he came up to me and he sat next to me. He's like, "How you doing?" And I felt like crap inside, but I said, I'm doing all right. I have really bad back pain. So he looks at me and he said, "There's nothing wrong with your back. What's going on in your life?" I'm like, okay. I didn't even want to continue talking to him. On the way home, most of the time on the way home, I was cursing him out with my wife, saying that he's what kind of person is that to tell me there's nothing wrong with my back when I'm suffering. Then I tried acupuncture. There was a little relief, nothing too significant. I was doing physical therapy a little, and then I decided after about 4 months, we're now in probably February or March, that I'm going to go see another doctor, a different one. So I went to another doctor, and he said, "Well, let's do an MRI. Let's see what's wrong with you. Let's see what's going on there." So as I go into the MRI, I remember thinking, I really, really hope this is like the worst result that it's going to come out, because I feel so. I want to justify how much pain I'm in and how much agony I'm in, and I think Sarno talks about it in his book. But when you're in such a high level of pain, and when it gets so severe, it's not only your pain, it's also your family's pain, because my wife was doing everything. I couldn't do anything. I couldn't lift the kids, and it's really, really hard on the family. So I was hoping for the worst possible result from the MRI, and it came back, and I have a slipped disc on L5S1 in my lower back, which was seemingly causing the pain. I went back to him and I said, "Okay, what should I do?" He said, "Well, I'm going to send you to get a cortisone shot in your spine, In Israel, it takes a very long time, so it was scheduled for about a month and a half later. And I said, well, what if that doesn't work? He said, well, then you'll probably need surgery. And that's something that I always, tried to avoid. But at that point, it was so long already, that I was definitely considering it. So a month and a half goes by. I go to the cortisone shot in Haifa, which is up north, and there was absolutely no relief. And then I was at, about a month later, this is already in May, maybe June, I was at a barbecue at my in-laws, and their cousin works at a hospital in New York, and he saw that I was suffering. I couldn't sit, I couldn't stand. I looked like a mess, and he comes up to me and he says, "What's going on?" I said, "Don't ask. I'm just a wreck. I'm suffering from sciatica and back." And he said, "Well, is anyone managing your pain?" So I looked at him and I said, "What do you mean? Is anyone managing your pain? Anyone taking care of you? Getting you meds? Are you managing it well?" I'm like, "No." He's like, "Well, I'll get you a number of a pain specialist in a pain clinic in Jerusalem." So I said, "Great." I called them. I said, "It's an emergency." I started also another physical therapist. I started working with another physical therapist at the time. I scheduled an appointment with this pain specialist. This is already in June, mid-June maybe. I walk into, and at that point, it got so bad that I was literally crying because I had to drive to Jerusalem. It was like an hour and a half away from where I live, and it was so painful. I walked into this pain specialist's office, and in tears, and I said, "I'll tell you my whole story. Just give me something to relieve my pain." So he opens up his cupboard in the back and his closet, and he said, "Listen, I'm really not supposed to do this, but I see the way you are." And he gave me a pill of Percocet, and I think it was Acamol, which is also a pain. He put me on like 3 different meds. He said, "But you have to stay in the hospital for 3 hours because you can't drive when you're under that kind of medication." So I said, "Fine." I sat on the floor for 3 hours. He said, "I'm scheduling you another cortisone shot, but this time it will be under an X-ray, so they could see what they're doing, and hopefully that will help." I said, "Fine, do whatever you want." A week later, he schedules, and in that week, I think it deteriorated the most. I stopped going to work. I could barely walk on my feet. And my wife was busy with the kids, so I asked my mother who I think is on. Yeah, she's here. Hi, Mom. I asked my mom if she could drive me because I couldn't drive. So we drove for the next shot, and there's no parking. There wasn't any parking at the building, so she had to leave me off at kind of the door of the building, and I literally crawled from the door to the office. I crawled, and I was in such pain, and I had to wait about, I would say, 2 or 3 hours for the shot. And I had my MRI, my claim to fame, my justification in my hand. And my mom parks the car, and I'm on the floor waiting to go in to get the shot. And she said, "Listen, you need to calm down. I'm going to go get you a cup of coffee and a croissant." So I said, "Fine, do whatever you want. I don't care." I didn't care anymore. She comes back and she said, "Here you go." She gives me the coffee and the croissant. And she says, "By the way, I bumped into a family friend from my hometown. And he asked me what I'm doing here. And I told him, about you. And he said, tell Michael to read Healing Back Pain by Dr. John Sarno." So I literally looked at her and I threw the MRI results in her face. And I said, "What are you talking about? Like, what do you want me to read a book? Do you see what state I'm in?" let's go into the shot. And I forgot about it, basically. At the same time, my wife was scheduled to leave the next day with my baby to the United States for a wedding. So I was going to be home alone with my 2 other girls for a week. So everyone was kind of freaking out, especially my wife, how she's going to leave me. So I did the cortisone shot under X-ray. I felt a little relief for, I would say, maybe a few hours. And then the next morning, the same thing, but it just went downhill to, I mean, those of you who are listening and are watching the show, who have experienced, pain, severe pain, sciatica, whatever it is, whatever you're going through, it's you feel very alone, because it's indescribable how painful it is. I literally wore flip-flops for the next week because I couldn't tie my shoes. It was so painful to just reach down to my foot. And so I went back to my mom's house. She drove me home. My wife left that night to the States, and for the next week, I basically was in my bed. This is like the second week that I'm in my bed not working. And all I did every day was, in the morning, I woke up, took my girls to kindergarten, went back, got into bed, and that was my day. And they came home. I let them watch TV all day because I couldn't be with them, and that was basically what I did. Now that was Wednesday or Thursday. Now it's Monday, and I had a really hard time sleeping also. And Monday night, my 2 girls who were with me were sleeping in my bed, and I wake up in the middle of the night, and the pain, I'm screaming, and my 2 girls are wake up from me screaming, and we're all screaming, and I look up to God, and I said, I surrender, like I give up, I can't do this anymore. And then I don't know why, I said to myself, Dr. Sarno, I have that book. I don't know why I have that book. And I said, I know I have that book. I crawled to the room I'm sitting in now, and I'll show you the closet. This is the closet. And I opened this is 4 a.m. I opened the closet, and the book is sitting right in front of me, Healing Back Pain by Dr. John Sarno. And I'm freaked out. I go onto my Amazon account on my phone, and I see that in 2011, when I got back from Thailand, someone obviously recommended me the book, and I ordered it, never opened it. And I said, what the hell, I'll read it. So I lie down on the couch at 4 a.m. And I've heard a lot of success stories and a lot of TMS stories, and I felt the exact same way that a lot of people describe. I literally felt like I was reading an autobiography, and just everything. I not only just the tone of the book, how simple he presents what's going on, and the fact that it's basically the source. The pain is real. It's totally it's 100% physical, but the source of the pain is basically caused by tension and emotions and from the brain. And the physical explanation was so simple that it's a lack of, it's a mild oxygen deprivation, and obviously described who gets TMS is, I fit the part, like totally being a people pleaser, a goodist, very, very critical of myself, and I would say being a perfectionist, but it's because I put so much pressure on myself. And I was blown away. Because it was like I felt like I discovered a whole new world, and everything made sense. It's like I felt like I was in a movie, and like at the end, like everything comes together like a puzzle. And there was no doubt in my mind that this is it. This is it. I found my, what I was looking for. I read half the book by 7 o'clock, I took my girls to kindergarten. I got back on the couch. I finished the book at 11, and I went for an hour walk. I haven't been out of bed 2 weeks prior to that. And basically, I felt that, you know, like he said, like it's a normal abnormality. It's the gray hair of the spine is what's going on. That's what he describes it. And, you know, to get back to full physical activity, you know, to focus on the psychological and not the physical. So from that moment on, I went back. I immediately canceled. I scheduled before that an appointment with an orthopedic surgeon. I immediately canceled it. I canceled all the physical treatment that I was getting, and I basically I had a few things that I was really determined. One is what I really liked about Sarno's approach was that he said, you know, make sure that there's not something serious going on, so get checked. And so that was the first thing I did, as I was determined to find a doctor that, you know, works, you know, with these kind of things in Israel. So I found Dr. Barbara Cohen in Ma'ale Adumim, which is about a 2-hour drive from where I live. And I drove down to her, and I walk in. I just said, I just need a confirmation that, you know, that there's nothing going on, and this is it. And she confirmed it, and I left. And then I was determined to speak to someone who went through it as well. So I got in touch with that family friend who told my mom that I should read the book. His son went through the same, you know, something similar, found Dr. Sarno. So I scheduled to meet him in a bar in Renana, and I was just basically obsessed with educating myself. I watched every success story on YouTube. I found Nicole Sachs, who has a very, very good YouTube channel, and she basically, she's very into journal speaking. So I started journaling every day for 20 minutes, followed by a 10-minute meditation. I think the things that worked most for me was just what Sarno recommended. I started talking to my brain and saying, there's nothing wrong with you. I'm going to the gym now, and I'm lifting. I'm going back to lifting weights after 10 months, which I didn't touch a weight, and I'm doing it. And I saw that the pain did not become worse with the physical activities. So I continued, and I was, you know, talking a lot to myself, constantly listening to podcasts and reading about it. And then I watched All the Rage by Michael, and I ordered Steve Ozanich's book, and I was just obsessed with TMS and fascinated about it. And then it was a very dramatic situation where I had to decide whether I'm going to start the basketball season, and that was what I feared the most, is getting back on the court and jumping and playing. And I decided to give it a go, and again, I didn't feel any different than I did when I wasn't, so I continued. And that was stage A, because after reading the book, I was still in a lot of pain, but there was definitely a significant reduction. But it took me, I would say, at least 4 or 5 months. I think about 2 or 3 months ago, I was just sitting one night, and I'm like, wow, I forgot about the pain. Like I didn't feel anything. And I think the moment when I was really, I would say, pain-free, which I don't believe anyone is pain-free, because we're all human, so we all experience human pain. But I would say chronic pain-free was when I let go. Like I didn't care anymore about the pain. Like even now, I'm experiencing the last 2 weeks some pain, and I think once you say I don't care about it, as easy as it sounds, and whoever's listening, trust me, I understand how terribly painful it is. But the moment I said, I don't care if it's there, like I know there's nothing wrong with me, I think that's what made the real change. So that's my story.
Wow.
Thanks, Michael.
That's a tremendous story, Michael. And I have to say, not it doesn't happen to everyone that just the day they read the book, they just go like for 1 hour and do whatever they want. But it is quite common that in a few months, people who accept the diagnosis really do get much, much better, and their pain goes away. And as you said, doesn't go away forever. It could come back, but then when it does come back, you have a plan. You know what to do with it.
Yeah.
I have to ask you a few more questions. You said that this man at dinner, he asked you what happened.
Yeah.
What happened in your life that time that the pain just
Yeah,
came?
it's fun. It's fun. Right. I forgot to mention the reason why I mentioned that story is because the second day after I read the book, I called him and I said to him, "You were." I started screaming, "You were right. You know, there's nothing wrong with my back. You know, it's fine." So, well, looking back when I was reading the book, and Sarno describes, you know, a lot of different situations. One of them is he describes a moment, you know, an experience where you may be going through a very, very, very stressful thing in your life. For instance, you know, someone's ill or someone's dying, and you're so emotionally invested in that thing, then like your mind doesn't need the pain, and the pain will reveal itself afterwards when kind of you're not totally focused with that. So I totally connected with that. In November, just to answer your question, why do I think it happened? Why did it kind of happen in November 2018? That was a super stressful month for me for three reasons. One, my youngest daughter was born in November 23rd. So maybe not knowing that caused, you know, some stress, I would say. The other thing is I officially opened my business. So I'm a basketball coach, and I was working mostly throughout my life for other people, and I decided to leave all that and to open my own business. And that started after the holidays here, which is like late October, November. And the third thing was I started a new job recently, but in my old job, I was coming towards the end of the year, and I wasn't meeting my goals, my sales goals. So I was under a lot of stress. So all that together, it makes sense, in my opinion, why it just all made sense to me. Why it happened, and to protect me, you know, the pain, like, you know, Dr. Sarno describes, is protecting you from, you know, feeling your feelings, you know.
Sounds really like a stressful time. It definitely can explain the symptoms. I want to just emphasize how men or fathers deal with all these stresses, because this is my one of my interests. And I want to ask you, how was that time that you were waiting for is it your third daughter, isn't it?
Yeah.
How was that time? What did you feel back at that time, if you can recall or remember?
I don't know if I could pinpoint that time, but I think in general, being a father could, you know, or a mother is a big responsibility. And, you know, obviously the pressure or the responsibility of supporting a family financially, emotionally, and kind of the balance for me. I remember a lot of times throughout my fatherhood, which is about 5 years, sometimes I had feelings of guilt of my balance between work and home. So I've definitely felt, I would say, again, putting self-criticism and guilt on myself of not being home enough, not spending time enough, being tired and not even wanting, to do things. So yeah.
It's kind of a pitfall, I believe, because as new age fathers, we're expected to be very present in our family. It's not like our fathers or our grandfathers that were the breadwinners and they were not expected to be part of the family or active part of the family. The women ran the house and the man just came and ate their dinner, got to sleep and got back to work. And today the situation is very different because we are as fathers and men are also expected to be the breadwinners and also expected to be very present. And this doesn't come together. As we have more children, we need to work even more hours maybe to bring the money home. And as society sees us as crucial part in the family, they didn't let go of the breadwinning part. Okay, we are still the main providers, and we cannot share it equally as probably some of us want with our spouses. How do you relate to that? Are you the breadwinner of the family?
Both me and my wife work. My wife has a career that enables her, thank God, to be with the girls from the time they're finished with school or kindergarten every day. So she has a profession that's good. But I think, on both parents, men and women, the whole balance it's stressful. Yeah, for sure. I definitely am less home. I'm more, at work and nights because I coach, and on Fridays, so I work 6 days a week. It's stressful, trying to balance everything together. Definitely.
Do you remember just before the first child was born? How did it change the family when you were first father? What happened back then?
How did it change the family? I'll tell you, the first year of my daughter's when my daughter was born, that was the craziest year of my life. It was a really, really, really stressful year. I was doing my MBA in Tel Aviv University. I was working full time. So I was working full time, and then Thursday night and Friday until like 3 o'clock in the afternoon, I was in school. And my father was at the time diagnosed with stage 4 colon cancer. So I was basically juggling between my work, my MBA, my father, and my family, who my first daughter was just born. So I wasn't home at all, and I mean it was a very, very difficult time, not only for me, for my wife as well, because she basically the first I would say 8 months of my first child's birth, life, she was alone basically. So yeah.
You can see how responsibility is crippling, isn't it?
Yeah.
Even the word responsibility.
Right, and I forgot to mention that one of the things that I was so blown away when I read Dr. Sarno's book was that the other symptoms that he was describing, which are typical to TMS, I've had basically most of them. So I've had, after my father passed away, a few months later, I started feeling pain in my stomach, and I have a hernia, and I've had skin issues. I've had migraine since I was a kid, which actually went away about 10 years ago, which is great. So, I mean, the whole book, I was like, oh my God, this is me.
Yeah. And often as doctors, we just concentrate on a symptom, and we don't ask about past symptoms and different symptoms, not just pain, not just back pain, and getting the whole picture, including childhood and adulthood, including traumas in the past. Even your dad who passed away could be part of it, of this overload of stress. And then,
and
and then when
unable
you
unable
then
to express the grief as well.
Yeah. I remember it's interesting because I remember when after in Judaism when a relative passes away, you sit Shiva, which is 7 days of you basically sit and and people visit you, and I remember after it was over, when I went back home, I made like a conscious decision that I'm not bringing any sadness into my house because I have a little bit, a little girl and a wife, and I don't want to bring any sadness into my house. So, that in a way was pushing. Maybe I wasn't dealing with something that I needed to. Looking back.
I want to relate to that because we as I want to tell about men. I hope I don't generalize too much, but as men we are raised up to man up, not to keep our
That's right.
feelings inside, and it happens from very young age. Like research shows that it happens from the age of 9 months. That if a baby boy cries or baby girl cries, the baby boy, they tell him just be a man, and the baby girl, she gets cuddled and hugged, and that's
Not so much in our house.
we try to change it as the new generation, but
Right.
this is how we were treated probably. And our society is very gender driven, and as men we have responsibilities that are, we didn't choose these responsibilities when we were born. They say women are sometimes they are referred as sex objects, but just to compare this, men, we are success objects.
Very good.
we we have to succeed. We have to just achieve our goals. We have to bring money home, and we are very harsh on ourselves when we don't achieve our targets. And women sometimes don't have empathy to this side of man, and they see us as like just going ahead and don't see anything outside. But we have this pressure on us from society. Like if a man loses his job or a woman loses her job, it's different.
It's
like
true. So true.
The shame and the guilt that men have when they are unemployed, it's very different when a woman is unemployed or a man is unemployed. And it just sums up until it gets to a threshold. And when we keep our feelings inside for so long and keep our sadness inside, just not to show it outside to our family, and then we feel guilty for not bringing enough money home and not being enough with our children. It all sums up and then the symptoms just come because we cannot deal with it anymore.
Yeah.
I would love to hear, Rose, what you have to say about the psychology behind it.
Well, Michael talked about responsibility, holding back his grief. I mean, that really came came through to me, and that whole notion that my grief is not worthwhile. I don't want to bring it into the family. Where did he get that notion from? Who put that in his head? Who told him that it wasn't authentic and not to share it with his wife and child? That whole concept that you said about the little boy being 9 months old and having to man up as a little baby, it's so resonating with Michael's story from my point of view. And the other thing that I noticed is that you've got a very deep understanding of this, and I believe that you've got some plans on your mind about what you could do with this for your generation of men. Am I on the right track? You've got
Are you asking?
in your practice, in your practice,
Okay.
you've got a focus on that now, haven't you?
Yeah, I studied, as I mentioned before, facilitating men's circles. And this was a big thing for me because it was the first time I participated also in a men's circle. And I think I learned in a harsh way that I need to share my feelings during the years. And the men's circle is the first time I think I felt comfortable sharing my feelings with other men. And it's like the men don't know about sharing much. Like we share about our experiences. Yeah, I went to this place and I bought this car, and I brag about my successes, but I don't bring myself with my vulnerability.
Yeah, and your fears.
To tell other men that I have a problem, I need your help. It's so difficult for a man to ask for help. Men don't go to therapy as frequent as women, and it's like we carry this burden with us, and we are even not aware that it's there because we are so disconnected from our feelings. And I feel that men's circles are our solution for that, because at first you hear about a men's circle, you say, "Why do I have to tell other men? Like, I'm okay. Nothing is wrong with me." But then when you hear other men's stories, and because there are brave men who share them, you hear your story. You hear yourself in their stories, and then you say, so it's not just me. And then you feel this empathy, you feel a part of a greater community and not so alone in the world. Because even sometimes you cannot share your wife with your feelings because maybe she would think I'm a crybaby. Maybe she thinks I'm not worthy to be her husband anymore. I need to stand up. I need to be a man.
Self-talk. Your
Yeah,
self-talk and self-criticism and depletes your energy, depletes your whole notion of your power and your strength and who you are as a man. I mean,
and women often laugh at men that we are sick and we are like childs. Like we cry at our bed, just help me. But just understand us women, if there are women there.
There's two women right here.
Yeah, other women. we don't have other opportunities. So when we are sick, when we are in pain, we suddenly have this window that we could ask for help, ask for us to be heard, ask our needs to be fulfilled. And it's a very short window. Then you feel better and it's over. You have to be a man again, not a child. So these are
Listen, just so you know, I mean, I would love to come to one of your men's circles and not be a
You're not
fly on
allowed.
the wall, because, because of women nowadays, we've become the men of the family. So could it be a co-ed men's circle? And I promise I think the men's circle is a brilliant idea, and it's the future. You're a pioneer, and it's very, very important. I want to continue our talk because it's really unbelievable, and I'm really excited to further this. And I want our audience to know that they can PM us, that our names and numbers are on TMS Roundtable, and we're available. There is one question. It's in Hebrew, and rather than I Google Translate it so I won't mess it up, I think I can show it right there. Do you see it, Amir?
Yeah, I could see it in Hebrew as well.
Okay. Can you?
It's not a question, just saying how awesome Michael is.
Yeah, he's a very good friend of mine, Michael Goldberg.
Okay.
He actually, when I was lying in bed, he was on that week, so he came to visit me, and he saw what state I was in. So
wow, he manned up. I'm glad about that. There has been some comments, and I know that a lot of people are watching, and I would love for any of my patients to man up and ask a question to Amir or to Rose. And some of the tools are, let me ask a question from the peanut gallery. Like, I could talk about my feelings. It doesn't always mean I'm in touch with my feelings. So what do I do, Amir? What would you say if I was sitting in your office? And then I want to hear what Rose would say. Michael would say, go out and shoot some basketball, but how would I be in touch with my feeling, and how would I trust that feeling?
First of all, we have some tools that you also mentioned last meetings to get in touch with the feelings. I think journaling as Michael also mentioned, is a very strong tool, because it's something you do privately. You have your own time, nobody bothers you, and then you just go deeper and deeper, and the paper just absorbs everything. So nobody sees it. You could not need to be ashamed of it. Everything that's written is getting torn afterwards. And this is one method. The other one that I think Rose would also relate to is just go back to the body.
Yep.
What do you feel?
Always.
What do you feel now in your body? And I pass it to Rose, because she's much more experienced than I am in this method of ISTDP.
Yeah. Well, I would look at how you approach anxiety first. That would be, like self-reflection on what's happening in your body when you're anxious. And notice that the anxiety comes down to block the feelings. And then I'd work on defenses against feeling that anxiety. So that
for example, what are the defenses? What are the defenses that I could feel?
Sarcasm, minimization, dismissing your feelings. Actually, that's a very strong one with TMS patients, dismissing. And as Michael said, he threw what did you do, Michael? Threw the book at someone.
At your mother. At your mother.
No,
that's right.
The MRI. The MRI. You threw at your mother.
MRI. Yeah, that's right. Yeah, like as if I've got any feelings. I'm the type of person that's stoic and doesn't need to tell anyone how I feel. And then going back and asking the patient where they are in their body, what's happening in your body right now, and then pointing out that is there some tension there? Do I see some tension? And in your legs or your arms or whatever, and just helping them to sort of go back into that space and honor it.
Beautiful.
And, that honoring of your body is just so important.
I remember in the, I'm sorry. Very good.
Go ahead.
Very good. I'm sorry, I didn't mean to interrupt you.
Yeah.
I remember in the movie All the Rage, which actually for a few days is being shown free from the Spirit Film Festival. If anyone's interested to see it, let us know. But from All the Rage, Michael was showing he was in therapy with his therapist, and she said, "How do you feel?" And he began to laugh. And then he began to cry. So we do have a question from Yoni Leader. He says, Rose, I'd like you to answer this. How does depression come into TMS?
Well, if you think about depression, it's holding yourself back, holding back your feelings, dismissing your feelings, and going into shutdown, really, about your feelings. I mean, Amir is a physician. He's probably more articulate in a diagnostic skill than me.
Yeah.
Are you self-criticizing yourself, Rose? Don't criticize yourself, Rose.
I'm expanding. Oh, thanks, Tovah. I always remind people when they're criticizing themselves. So go ahead. Sorry.
I don't want to go into diagnostics, to the DSM, to the book of psychiatry that diagnose people, but I do want to mention the difference between depression and sadness.
Good.
As sadness is a primary emotion, which actually serves us evolutionary-wise. Depression is actually the secondary emotion, which is not really emotion. It's like the thoughts that we have and what we think we are, what we think will be in the future. And this is depression. Depression is like a race of thoughts that we are desperate. We could not do anything. We don't see any bright future. Like we have these black glasses on and we see everything in these glasses. As we let ourselves feel sadness or any other feeling, it just passes by, it just passes away. And depression stays because it's a cognitive thing. It's not just an emotion, it's the thoughts that just race and race and race in our minds that keeps us depressed. And the question was, how does depression come into TMS? Because we don't want to feel these emotions. I want to mention again I love the part, the revelation that Michael had when he was given in. You told us that you gave in when your daughters were laughing.
Surrender.
Yeah, you surrender. You gave in to this feeling, and when you give in, you let the feelings come. You don't fight it anymore, and then there is a path that could get you out of it, and this was the path to your closet, and the book, and then the revelation came just because you were not fighting it anymore. And it's interesting, just the story.
I'd also, are you?
No, you could.
Yeah. So I also want to elaborate on that. Also, not only surrendering when I was suffering and that night, that pain, but also in my healing journey. I think it's really important for whoever's listening and who's going through a really rough time, that I remember during the beginning in my healing process, sometimes you get you may understand from a lot of the information out there that like you have to find this one feeling that you're not feeling and you're going to be fixed. And I was killing myself over it. Okay, I have to dig down, and what is it? What is that, trauma? What is that feeling? What is that thing? And when I decided to just be, to just be and just, and to surrender, I think that's when I made my biggest breakthrough. And I just said to myself, just feel, make sure you just feel whatever you're feeling. So if I was angry, I was going to be angry until the maximum that I could, just be whatever it is, and stop trying to look and feel and do this active, just be. And I think another really helpful thing for me was what's called visualization. So I would envision myself on the basketball court, jumping, dunking. I remember when I was in a really, really dark place, and I used to look and I used to see people riding their bikes and running and doing the airplane thing with their kids. And I felt so sad and so jealous of people who are able to do that. And when I started, seeing myself being able to play ball, being able to run, it helps. It helps when you start, seeing yourself being better. It really does. You're training your brain. You're changing the neural pathways of your brain and your thought process, and that really helped for me.
As you visualize the brain, it has the same effect as you actually doing the same thing in reality. Like
it sounds crazy, but it really works.
Yeah, it
works. Your subconscious. This is science, and I'll find the research. Your subconscious does not know the difference between the visualization and the reality. So you begin to retrain the brain. I wish I could explain it. I read about it, and I would love to send people the article. It is true about the visualization. It becomes a reality in your brain, and then the chemicals change. So fascinating thing about visualization, and that's with your meditation also. So we do have a question. So I hope, Yoni, that we answered your question, Yoni, but please answer it, repeat if we didn't answer your question, but that was a terrific answer. Stuart says, my pain started around the birth of his second child. Everything I read about TMS tells me it's repressed emotions. However, after 18 months of pain, he became very moody and angry, and he showed all his emotions verbally. And in journaling while he was calming his emotions and nervous system, yet he was still in pain. So he wants to know what he was missing. He was journaling. He was moody and angry, and he showed his emotions verbally. He was journaling. He meditated, but somehow, maybe Rose, you can figure this out. Like, what was he missing? There's some disconnect there with his tools.
Yeah, he was discharging his emotions instead of holding them. He wasn't recognizing them in his body. He had them in his brain and his mind about his emotions, but did he find out what was happening inside in him? What was happening in his gut at the time? Was it sort of, did he have reflux? Did he have diarrhea, constipation? What else did he have going on? And was that preventing him from having an experience of his feelings? Because as Amir said, as little boys, as little children, we're told to not cry, keep quiet. It doesn't matter if you're sad. Man up. And the result is that those emotions are repressed, and then they're in your thoughts, and instead of in your body.
I want to add something to take this opportunity to mention two other things that make men really rageful after the wife is giving birth. One of them is their attention is getting away from them. So if, as a couple, the first child is really, it showed mostly in the first child, but it could be seen also in the second and third. And as men, we are with a woman or with a man, doesn't matter, and we get the full attention of our spouses, of our partners. And then when there's another creature, a little child comes into the family, it's a big joy, but also, and it's not easy to acknowledge it, is also competing for our attention. And I remember that when my wife was pregnant with my first child, I was not getting attention even during the pregnancy. And then I thought, what would happen now when she's born, and I would get no attention, and it pissed me off, and it's important to, like, rationally, it's not rational, and because emotions are not rational. It's not rational. You have a new baby, you have to be happy, but this little bastard is taking away my attention.
and lack of sleep.
and this is one, and the other one is that I don't remember what I wanted to say. I get less, not just less attention, but also, the children could really be annoying sometimes, and this is something also mothers have. They cry, and sometimes we wanted to bring this child to the world, but it's really normal that sometimes we want to throw it away to the garbage bin. It's normal. It's not normal to do it, but these feelings are normal. We say, why did we become parents? I don't want this kid, and these feelings are so distant from us because we are ashamed of them. We are ashamed that sometimes we hate our kids, and I purposely use this word hate. We sometimes want to get rid of them and want to just go along with our lives, and they disrupted our lives. They disrupted our careers, and sometimes we are so rageful at them, and at the same time so shameful that we feel this way. And this also a very big conflict that raises these symptoms up, this pain. Hi.
Excellent. I mean, Amir, you're being very expressive, and I think it's very important to be comfortable with your expression. And There's another question, but yeah, say a few words about that, and then I'm going to answer another question, Rose, because just comment on Amir's complete and thorough expression of the reality of what all parents go through.
Exactly, precisely. But judging it is the problem, isn't it? Isn't that the big problem? Judging what you're thinking, because no one else knows what you're thinking. So why are you judging it?
Yeah, if you tell yourself, that's normal. That's normal that I'm feeling this way. But mostly we tell ourselves we are awful parents. How could I have this thought in my mind?
So you're feeling guilt. You're feeling guilt.
Mm-hmm. Yeah, for sure.
So there's another question from, and I don't think this gentleman is from any place close to us because his name is super Spanish. His name is
from Madrid.
Yeah. Oh, let's just show the question. Miguel was diagnosed with TMS a year ago, and he's been trying to heal it since then. Do I have to find the one trauma or repressed emotion responsible for TMS in order to heal? Or is it a series of traumatic events and repressed emotions throughout life that are responsible? And I shouldn't be looking for a particular event to heal. It's a good question. Who wants to take it on? Excellent. Thank you for asking that question. What a beautiful.
It really relates to what Michael said before about finding the right emotion or the right event that caused this pain. I believe you don't have to find a culprit You just need to ask the right questions. And asking the questions opens your mind to accept different things. You don't have to know exactly what was your childhood trauma, or what exactly is the repressed emotion. You need to feel it in your body. You need to be present with it, to surrender to it, like Michael did. I believe this is the beginning. As you surrender to it more, you get to know more. But as men, exactly that, we have this target and we need to get to it. And sometimes it offends us and it serves us well.
I want to say, I want to be like rhetorical. Well, wait a minute. What do you mean surrender? Like, what do you mean let go? So what I want to say to Stuart and to Miguel from Madrid is that this needs to be a habit. We get up every morning and brush our teeth, okay? I don't think about it. I put on my lipstick, I get in the car, I get to a place, I don't even think about it. It becomes a habit. These are habits. And this is so important to understand. We are not talking like off our head, oh, just surrender. It has to become a habit. And anywhere from 5, 6, 7, 8 days to 40 days. There's no science. This is an art. The human body is an art. The feeling is an art. So Stuart and Michal and all the people, Miguel. I'm speaking so much Hebrew, I can't speak Spanish. So what I'm saying is that it has to be a habit. You have to learn it. You have to do it every day. Journal, meditate, talk to the brain, talk to your friend, talk to your coach, talk to your wife, journal again, meditate again. Dr. Sarno said, knowledge is the key. And please, anybody on this Facebook Live, PM me I have a set of tools in Hebrew and in English, and I'll get them in Spanish as soon as possible. But repetition is the most important thing. You're working with a mind, and the mind is used to not feeling, and now we're learning to feel, and now we have to learn to surrender. How do we surrender? It has to become a habit. You must be patient. You must be very, very patient with yourself. And this is the letting go. And, we give the example of the man with the phantom leg. He gets his leg cut off, and he's wanting to know why he still has pain. He has to learn to not feel the pain, even though the leg is gone. It's a habit. So I want you to comment on that in a minute, Amir, but Stuart just said, thank you so much. It sums up exactly how he felt over the past 18 months and something he has spent time and continued to work on. All the honor, Stuart. This is a lifelong journey. None of us on this podcast, on this webinar, has not experienced TMS. I get hives every couple of months, and I thank God that they're not on my face; they're on my legs. So no one's immune. But I wanted to have Michael and Amir, and Rose is probably now being a grandmother because it's now 6 o'clock or 7 o'clock in Australia. But Michael and Amir, we may get a few more questions. But what do you think about the repetition, which is something I'm a little tough love about? You got to keep doing it over and over and over again. What do you think about that?
Yeah, just to elaborate on that, and Miguel, just to answer your question, for me, I think what's really important is to calm your nervous system. That's the goal here, I think. And from my experience, what I've learned and what I've experienced is we get pain when our nervous system is in a state of fight or flight. So find whatever you find comfortable for you to calm yourself. If it's going to the beach, with a beer and sitting and just enjoying like the sun and the good weather, do that. But do that every day. Do that every day for a half hour. If meditation does it for you, meditate and keep going, and like Dr. Tovah said, you know, have patience and have kindness for yourself also. And if you don't feel like doing it, there was a lot of times where I was so dreading doing the journaling, and I was afraid, oh my God, if I don't do it today and I miss a day, my pain is going to come back. And no, if you don't feel like it's good for you, don't do it that day, and be good and be okay with yourself. You know, like pat yourself on the back and say that's fine. You know, if it do whatever. What I did is, from my experience, I took like one or two or three things that was working for me, and I did that, you know, as long as I could, and whatever made me feel good. Whatever I didn't feel comfortable with, I didn't care what anyone says. I wasn't going to do it. And I totally agree with you, Dr. Tovah, to, you know, have patience, and eventually doing things that calm your nervous system and doing things for yourself, even if it's only a half hour a day or an hour a day, that's what's going to get you to the real, you know, to feeling good, in my opinion and from my experience.
I want to comment on both of your what you said. And first is that repetition is important, and our minds are wired to prevent us from doing things that change our reality, even if our reality sucks. Just want to stay the same situation. Don't mess up what I know. So our mind will always tell us, don't do it. There's another thing that you could do. And it's like you never want to clean your house, but when you are studying for an exam, you start cleaning it. So the same, we will always have excuses why not to do it. And as I'm saying that, I'm also telling my patients, you are perfectionists. So be aware that you don't have, you should do it regularly, but if you don't do it, don't be harsh on yourself. As Michael said, be kind. You are doing the best that you can, and you're doing the best that you can for your mind. And it's not an easy process. You are brave for coming to me and doing these steps. And not everyone could deal with it. And you know, many patients came to me for first session, and they said, you know what, I can't do it. Like, I don't want to go through these emotions. They wouldn't admit it that they want to have pain, because it's not true. The subconscious mind tells them, no, the pain is it's trying to protect you from these feelings that you don't want to feel. So, Michael, you were so brave just to reach out and get some help, and help yourself by reading the book, by doing these exercises. But not everyone is up to it. And so both are needed. Also, doing these things regularly, and then again with the same in the same breath, just being kind to yourself, and know that if you don't do it, it's also okay.
Excellent. So Rosie's coming back on. I just have to bring her up. Hold on. Yeah. Amir, there she goes. Hold on. I wanted to ask you about talking about a patient that maybe, like, I think it's important to understand that this is very hard to take responsibility for your own health, that the medical system, you know, it's not their first choice.
For sure. Patients come to me to the general practice, and they are looking for a pill or something that would make them better immediately. And TMS, usually, it's not a magic pill. sometimes people read the book and they are healed, but they still, it's the beginning of the process, like you experienced, Michael. But TMS is hard work. Also, it's the recognition first, accepting the diagnosis, but then being in touch with your feelings after you were so distant from them for such a long time is a process.
Very good.
And here, my daughter is here.
Oh. Let's bring the kids on. Oh, let's bring the kids on.
She just woke up.
Yeah. I'm going to bring Rose up in a minute. Hold on. Yeah. Okay. There goes Rose live. Rose, we were talking about, first of all, I know there's a lot of people watching us, and I would love for them to ask questions. But we probably will say goodnight in a few minutes. And it's like midnight here, so that's interesting. Almost 11:30 that his children woke up. I think it was about. So Rose, we were talking about.
I've been here all along.
Oh, good, good. What do you think? What do you think about the? What would you think about when talking to a patient about the repetition and the habits? Like, all right, I felt my feeling. I felt my fear.
No.
I felt my pain. I'm ready. I'm done. Why am I still having pain? I'm fear. I'm full of fear. Okay, why am I still in pain?
No, because I don't go down that route. I just go to their feelings in their body and help them to reflect. So it's a very personal experience to sit with someone and be close to them and try and reach them. And then when they put a barrier up to me reaching them, I point it out. You know, if they dismiss their feelings, I point that out and allow them to see how they self-neglect and how they put other people first, and maybe how they put my feelings first rather than their own feelings about being in therapy. Yeah. So it's more about just being present with that person and giving them a safe space. Not your area is about, repetition, but my area is about just being present with that human being and creating a heart-to-heart experience with them.
It's really the answer. It's like it immediately creates some.
And then when they go home, they can maybe the stuff that's come up for them, maybe they could journal that sort of thing.
So it becomes a good process.
Yeah, but in the moment, I'm not. I see all those things as a deviation from their feelings when they're with me. They tell me about the journaling. Okay, that could be a catalyst. I journaled about X, Y, and Z, and then I'll turn around and say, well, how do you feel that in your body? What's happening in your body right now? So, yeah. So
it's like a new habit to even do that. Like, what am I feeling in my body? Like I'm learning a new habit to be in touch with my body.
Yeah.
So here's a question. It's a question from Peg. You see the question? Michael, you want to answer this?
Yeah, sure. Hey,
the question
Peg.
is, had Michael had any history of any mind-body symptoms in his past, like migraines, gastritis, IBS, reflux?
Yeah, so as I mentioned, I think my earliest memory of mind-body symptoms was when I was studying for the CPA exam, which is a very, very long process, and it's like 3 months of studying from day and night, and for this big 8-hour test, which is really intense. And I have a memory of, I used to study with 2 friends from school. They used to come over to my house every morning, and we used to study from 9 o'clock in the morning till about 8 o'clock at night. And for the first hour and a half, so from every day for the first hour and a half, I would lie down on my couch with a hot wet towel, and I had the biggest migraine every single day. And now looking back, I'm convinced that it was because of stress and nerves of passing the exam. I've had also a few years ago, as I mentioned, I started having pain in my. It wasn't such bad pain. It was like reflux, like you asked, in my stomach, and I did a colonoscopy, and I have a hernia, which, by the way, after since reading the book and going through the whole healing process, I've had no symptoms in terms of that. And for the last, I would say, year, I've been dealing with super dry skin and eczema on my hands, which I'm still dealing with today. Which I don't know, probably it's mind body related. And so, yeah, to answer your question, yeah, I've had a whole lot of mind body symptoms, in my opinion.
Yeah.
What do you
It
think
seems
about
to go
that?
from
Yeah.
one area to another, doesn't it? Depending on what.
Yeah.
You know, when you don't address your feelings in your body, the symptoms come back to remind you that you've got more to deal with.
Mm-hmm.
And like that whole sense of responsibility is what you've actually spoken about, Michael, and that whole sense that you've got to be the perfect dad, you've got to make sure that you do well in your job and all those things, and then that eats back into your heart, I suppose, in a way, and says, I'm not good enough.
Mm-hmm. Yeah.
Does that resonate with you? Yeah.
Again, it's hard for me to pinpoint exactly, what the reason or what it is that, that to kind of reveal what exactly is going on. So I'm more focused now of just trying to calm myself and to soothe myself and to calm just to and to feel my feelings and to and every time I start feeling pain, the first thing I do is I go out and I do the most difficult physical activity. I go for a run, I go lift weights, I go play ball, and I don't feel pain and I don't feel worse. So like it just, I keep on, it's a way of kind of keeping my mind convinced that there's nothing serious going on physically. And once I, if I'm sitting down, I'm in a lot of pain, and then I go and I jump and I run and I don't feel worse, then obviously, there's something else going on. Something else going on. Yeah.
I want to say something about TMS people, the patients that I've met, and I'm grateful to have been working with people over many, many years. TMS patients are strong and sensitive people. We are not lightweights. So of all the insecurity and security, we're very strong and sensitive. And I think part of the problem, maybe you have found this, Rose and Amir, and I think Michael is a good example, is that we have a high sense of ourselves, and we're a little frustrated how we can't get rid of this pain. And we can't accept the fact that so it's almost like an inferiority, superiority complex, which is, again, brings us back to knowing ourselves. So Rose, the tool that you're saying is about the feeling, but it's like up here in my head, it's like, am I intimate enough with myself to really understand what's going on with my ego and my self? And it's all back to Psychology 101, and that's what's beautiful. That's what the bittersweet is about the pain. And just talking about Corona for a minute, there's a gift in Corona, and there's an enormous amount of pain going on, losing loved ones and our own effect of the economy and how we all feel for each other. And it's definitely, I would ask all the viewers and all my friends and all my family, all the people, all my enemies. No, I would ask for all to find a gift in this corona. I mean, we're not a victims of politics. We're not a victim of this president. We're just simply living our life. And, you know, my wish for you is to find the gift in corona, because there is gifts in negative things. There's big growth spurts. I mean, I can't imagine the pain that Michael went through. I can't imagine that pain. And yet he found an incredible gift, and now he's here to help others, as we all are. So if there's no other questions coming from our Facebook family, I want to hand it over to Rose to maybe say a few words in saying goodbye, and maybe some breathing.
Yeah. I would like to wrap up in a way and talk about what has happened with Michael and the example that he's shown us, and the fact that the self-criticism and the sense of responsibility eats away at the heart, and the heart then says, I've had enough. So in wrapping up that whole notion that I'm okay and that I'm enough and that I am complete. And I'd like to just pass by the whole idea that we were brought up this way, as Amir said. We're brought up to be tough. And we, in our family of origin, we've been told how we should be within that family circle. So from that point of view, I'd just like to wish you all a lovely day. And I'd like to spend a few moments just reminding us how it is important to breathe. Because it's our life-giving source, it's our spirit. And I'd like to just ask you to slowly inhale deeply through your nose. Maybe close your eyes and be aware of any tension in your body. Release that tension as you observe it. Let it go. Just like you let go your racing thoughts and your sense of responsibility. And as Michael said, just be present in the moment and allow that feeling to resonate through your whole system. So as you breathe in softly, hold your breath, breathe out slowly, and feel calmness overcome you, overcome the anxiety and the tension. And stay present to that. Quietly, in and out. Feeling your shoulders and your jaw relaxing. Calming your whole system. In a TMS model, patient is usually tense. Observe that. Observe how it's holding you. And there's a notion that you're being kept safe in that model, but you know you're not, don't you? You know that it's a false safety. It's not giving you the peace that you want. Each day, hold your breath in your mind and breathe in and out slowly, and especially if you've got tension and anxiety happening. I'll say goodbye to you all and thank you for coming, and all being well, we will see you next week when we have two filmmakers talking to us.
Next Monday.
Forgiveness, about forgiveness. It should be very interesting. Thank you.
Thank you for having me.
Laila Tov.
Take care.